Hi, and welcome. I'm Dr. Lisa, a doctor of physical therapy, certified cancer rehab specialist, and a yoga instructor. And welcome to this first in the series of Yoga for Recovery After Breast Surgery sessions. These are sessions I've been teaching my clients for several years now in the clinic, but I wanted to offer them to you wherever you may be right now so that you can access the same information and helpful recovery tool in the comfort of your own home. This very first session is ideal for someone perhaps has never done yoga before, or someone who is really just recovering from surgery in the very beginning when the drains are out and your doctor has cleared you to begin an exercise program. So do not start any program without checking with your physician first. You may use a pillow to support yourself. If sitting up straight and tall is uncomfortable, you can put a pillow behind your back. I'd like you to have a sturdy, comfortable chair without armrests, ideally, so that you can sit up nice and tall with your feet flat on the floor. You can have shoes off or on, whatever makes you most comfortable. And just have some loose, comfortable clothing so that you allow some freedom of movement. Always, I ask you to honor your body and honor whatever you're feeling with the movement at any given time. Just because it looks reasonable for me, I want you to do what's reasonable for you. So be patient, be kind, treat your body and this movement as if you are doing this to your best friend. Be nice, be gentle, and be patient with the process. This is going to be very supportive, head to toe mobility today. We're going to move really slowly. We're going to work with the breath, which is really important for helping to stimulate recovery and support of your lymphatic system as we go. And these movements and stretches are not only helping you to restore and recover your mobility after surgery. As we coordinate breathing and movement, it helps regulate our nervous system and reduce stress. And it also helps to improve our immune system and support our immunity. And it helps with the circulation in the extremities. So this is really boosting your recovery in so many ways, but it is such a gentle practice. So healing today for body and mind, starting in a chair. Future videos will have both mat-based exercises and standing-based yoga poses. This series will progress up to a more intermediate level, not advanced by any means. So feel free to jump into whatever video feels best to you on any given day. Okay, so let's start with finding our comfortable seated position. Hands can be resting on our thighs, either palm down or palm up. And we want to be sitting up nice and tall in a nice kind of dignified posture. And you may start with your eyes open or your eyes closed. I'm going to close my eyes. Take a deep breath in. Exhale fully. And just take a moment to try to come completely into this present moment experience. Feeling the support of the chair under my hips, feeling the upright posture of my torso, feeling the hands resting on my knees, and feeling the breath as it's moving in and out in its natural rhythm, coming into this present moment. And settling into this experience as we move forward. You may open your eyes if they were closed. And let's initiate this practice with a full deep breath in and see if you can soften the belly. Soften the belly and allow the breath to go all the way down into your belly. Exhaling through the mouth. As much as you are able with these few deep breaths, allowing that breath to travel down into your belly, and then feeling that sensation of the air expanding up through your chest and ribs, and you may even feel a little rise in the shoulders. That three-part breathing: belly, chest, and shoulders. In order for the breath to get to our belly, we have to soften where we're often holding here. Often hold that belly in and hold that belly tight. And we want to soften there, so we allow the diaphragm to drop down. And then the diaphragm rises back up as we exhale. And this is very important to supporting our lymphatic system and reducing stress because it's directly connected to our parasympathetic nervous system. So, one more time, nice breath into the belly. Exhale through the mouth. Excellent. Letting those shoulders drop away from the ears. Good. Let's go ahead and inhale, let the shoulders come up. Exhale, let the shoulders roll down. Inhale, shoulders up. Exhale, shoulders down. Nicely done. At your own pace. And exhale. And relax right there. Maintaining that nice tall spine position. Let's turn your head to your right, looking over your shoulder. In breath. On the exhale, return to center. Inhale, turn to the left. Exhale, return to center. Now, if you're not able to work that coordination with the breath and movement, do not worry. That's just fine. Just do what feels natural and comfortable for you today. You can just work through the movements and not worry too much about the breath. If that feels too challenging, that's no problem. All right, now let's place your hands on your chest, just gently stretching this skin on your chest down. Let's lift the chin straight up with a closed mouth. And release that chin back down to center. Now hold this position, and we're going to lift the chin up and slightly to the right. And release that chin back down to center. Taking our time, feeling these sensations stretch in our body. Let's lift the chin up and slightly to the left. Excellent. One more time, lifting straight up. And exhale back to center. Always going just as far as feels safe, comfortable, just for a gentle, very nurturing stretch in our bodies. Go ahead and bend the elbows to approximately 90 degrees. We'll cross those elbows across our tummy. And then we're going to reach our thumbs in opposite directions, squeezing the wings and the back gently together. Opening the heart, lifting the heart. Exhale as we close the door. Inhale, lift the heart, squeeze the wings, open the doors. Exhale to close. Inhale to open. Exhale to close. Beginning some of that gentle movement in the shoulder, but still keeping the arm fairly close to the body, safe and supportive. Warming up the rotator cuff, maybe tighter one side than the other. No problem, not a surprise. One, and close the door. Good. Let's release the hands to the knees. From here, we'll go into a seated cat and cow. So cat will be to tuck the tailbone under, tuck the chin to the chest, and reach the middle back for the back of your chair, broadening the back. And then, if you can, inhale while coming forward into cow. So as we come forward, we tilt forward on the pelvis so the tailbone comes up, the heart lifts, and the chin lifts. If you can sync it up, we'll exhale for cat. Hands are resting softly on the knees or thighs. Inhale for cow. Getting motion through our spine and rib cage. Inhale to rise. Exhale to neutral. Feels so good. Let's release our hands at our sides. Let's inhale the palms up to the shoulders. Turn the palms over as if you're pressing them down as you exhale. Rotate the palms open. Inhale to the shoulders. Exhale, turn them around, press them down. Rotate palms forward. Inhale. Turn them palm down. Exhale. One more time. Forward palms. Inhale. Turn around and exhale. Excellent. We'll lace the fingers together. Actually, we'll just place the palms and the fingertips together here, bringing the fingers maybe at about eye level and allowing the elbows to come as close together as feels safe and comfortable for you. Now, I haven't had surgery, so it's not restricted for me or it's not tight. But if that feels like too much pressure, just stop wherever feels safe. The goal eventually is that the forearms come together, but wherever yours are is just fine. Okay, and then we're going to let those elbows roll out while we keep the palms together. And stretch through the wrists and fingers. Inhale and relax. Exhale, elbows out, hands come down. Inhale, fingertips up. Exhale, palms come down. Good. Now lace those fingertips together. And we're going to stir the pot. So let's imagine that there's a large cauldron in front of you. And you're holding on to the one large wooden spoon. We're stirring the pot using both hands and moving our trunk forward, stirring the pot in a clockwise direction. And then in a counterclockwise. Last one. Bringing the hands back, elbows at our side, keeping the fingers interlaced, checking for that tall seated position again. Chin stays tucked with a long neck. And now we're going to use the benefit of both hands together to try to reach up to whatever level feels safe today. As we inhale, reach. Exhale, lower. Inhale, reach. Exhale, lower. Going just as far as feels safe for you today. And as you work on this, you'll find it gets easier and easier and feels better and better. Good. Let's relax our hands back down to our knees. Shake it out just a little bit. We're holding a little tension. Just move the body loosely to release some of that tension. Nice breath in. Nice breath out. You'll see I close my eyes frequently when I do yoga. It helps me tune in to the sensations in my body and what I'm really feeling and experiencing with the breath and the movement. Okay, so with this nice tall posture, we're going to place the left hand on the right knee and the right hand just back somewhere gently on the seat behind us, wherever it feels most comfortable. We're going to inhale up to be nice and tall, and exhale and turn to the right, looking over your shoulder as far as feels safe. And just maintain this position. If it feels better to turn your head back, that's okay. You can do that. Holding this nice little rotation. One more breath here. And release on that exhale. Nice job. Good. So we'll place the right hand on the left knee, left hand back in the chair behind you, wherever it feels safe and comfortable. It can even be on your hip. That's okay. Inhale up to be nice and tall. Exhale, and we're rotating to the left, looking over our left shoulder. Again, just to wherever feels safe, only going so far as feels comfortable for you today. Focusing on that nice tall spine. And releasing that rotation on the next exhale. Nice breath. Okay, with our hands resting on our knees, let's roll some circles over our pelvis. Loosening up the hips and the low back. Excellent. Good. Other direction. You know, often after surgery, we can be in this very kind of protected posture. And these are just nice, gentle movements to help with any stiffness or tightness that develops because of that. Right, now next, sitting up, extend the right leg out and pull the toes back for you. And that knee does not need to be straight. It can be slightly bent. That's okay. With your hands on your hips, really lift that heart up tall. And we're going to bend through the hip joint, keeping that nice long spine until you begin to feel a little stretch in the back of the leg or the hamstring area. Take a little breath there. On the next inhale, we'll come back up to tall. Good. Maybe adjust that leg position a little bit. Let's inhale, tall spine, heart lifted. And keeping that long spine tilting forward until that stretch in the back of the leg becomes apparent. Sending the breath down into that hamstring and releasing back. Good job. We'll extend the left leg long, sitting up nice and tall. Big breath in as we lean forward on the left leg. And you may feel a similar sensation, and you may feel it in a different location. It's not unusual. Good, and release. And reset, wiggle that leg around, find a new spot for it. Lift the heart. Keep that heart lifted as you tilt forward, feeling that hamstring, breathing into that leg. Exhaling fully. Good job. Let's extend that right leg out. Draw some circles with the right big toe. Clockwise circles, counterclockwise circles. Good. Bring it back. Extend the left leg out. Draw some circles with the big toe. Left, right. Clockwise, counterclockwise. Left, right. Not exactly the same. You get what I mean. Good. Wonderful. Okay, so sitting up nice and tall again, we're going to inhale the shoulders up, back, and down. Up, back, and down. And let's bend the elbows. And we're just going to do one more round of gentle shoulder movement. We'll inhale, reach with the right arm. Exhale, lower it down. Just going as far as feels good for you. Inhale, reach with the left arm. Exhale, lower it back down. Inhale, reach with the right. Lower it back down. Inhale, reach with the left. Excellent, good work. Last one, both arms reaching up as far as just feels safe. Exhale. Lower those arms back into your lap. Excellent. Now, if there's a backrest on your chair, shimmy yourself back to where you feel supported. Rest your hands in your lap. Let's just take a moment to notice the sensations in your body. You may close your eyes for just a moment, bringing your attention to the breath, moving in, moving out, and any sensations at all that are present, just noticing them with compassion and curiosity and without judgment. Just sit with your breath for just a moment. Really great job, great work. I just applaud your courage for coming to try to do this for yourself, for your body. I hope that this was beneficial and that you found it valuable. If so, please hit the subscribe button on my channel, and it really helps support me to continue to produce free content for you. All the best. Namaste.